Let's now welcome His Excellency Dr. Mohammed Pate, Nigeria's Minister of Health. They have Vice President of Global Programs at the Susan Thompson Buffett Foundation.
Very good.
Welcome to you all.
Thank
you very much for taking the time to be here. So, Mohammed, if we could start with you, please. You are leading your country through critical health reforms. What's your vision, and how is it going to change health coverage for Nigeria's poorest and most vulnerable people?
We are a young and fast-growing country, and our health outcomes have been improving over time. But there are other elements like non-communicable diseases that are rising as the fastest growing segment of our morbidity and mortality. Under the President's Health Sector Renewal Investment Initiative, we're expanding access to quality, basic health care through the primary health care system, expanding the primary health care centers that are functional from 8,800 to 17,000, retraining 120,000 frontline health workers and enabling them with digital technology to function, expanding the affordability through the Vulnerable Groups Fund to ensure the poorest and most vulnerable are able to afford the services that they need, to improve maternal and child health, immunization, as well as deal with other elements of the evolving epidemiology that we're seeing of hypertension, diabetes, and other diseases. That is the approach that we're taking so that we can guarantee basic health care to all Nigerians over time, to raise the domestic resources, and to work with our partners in a sector-wide manner as a federal system between the federal government and the state governments, as well as development partners and civil society, so that we pull in the same direction to improve health outcomes. Over time, we expect that Nigeria's health outcomes trajectory will improve, that life expectancy can improve, and that maternal morbidity and mortality will reduce, because many of the diseases are actually preventable with simple things that can be delivered at the primary health care centers. So on our path to UHC, these reforms are getting us closer to saving more lives, reducing physical and financial pain, producing health, and to do it for all Nigerians so that we don't leave anyone behind. That's what we are undertaking right now in Nigeria.
That's the vision, that's the goal. How's it going? What kind of challenges are you facing in implementing and also sustaining these reforms?
It's been an exciting journey. I think we've got the highest level of political leadership from the President. And as Tedros says, it's a political choice. Nigeria made a political choice to prioritize health investment and the well-being of Nigerians. So we're seeing that easing the path. State governors are joining along, and development partners like the bank, like WHO and others also are rallying around this effort. Challenges of human resources are certainly one that is not limited to us. We've doubled the intakes for our physicians, nurses, midwives, pharmacists to increase the production of health workforce in our country, to redistribute them, and also to create the enabling environment so that they can stay and function. That's one challenge. But financing is a key one. And the financing gap that we have, certainly we're very encouraged when we hear Ajay mentioning 1.5 billion, and that's a significant commitment by the bank to actually do that. But then backing it with the resources that are needed. You can scale. For Nigeria, for instance, we can deliver 100 million out of that 1.5 billion if the resources are there. And we're really seeing appetite from our development partners to contribute. Some of these are doing this quietly, and some of them are actually working programmatically, in addition to the technical support, to get us closer to our aspiration as laid out by the President in his agenda.
It's an immense task, but one that needs doing. So, Mohammed, you've seen this issue from many different perspectives, from the global level to the country level, from the private sector, and now to the public sector. You're a medical doctor as well. You've worked in an emergency room. You know this issue inside out. So if we were to meet in 1 year from now, what do you hope will have shifted in the global and country discussions on universal health coverage?
Well, first, on the UHC agenda, I think even before COVID, we knew that we were not on track at the pace that we are making progress. Pandemic came and derailed us even further. So going forward, continuing on the same path will not meet our objectives. So there are some shifts that are needed. And with countries at the center, and what we're trying to do in Nigeria is articulated a vision, a direction, defragmented the landscape with the subnational levels also aligned with us, and having our supportive global partners come to back us up with financing, with technical support, but following leadership of government and using national systems that are more sustainable, and let's hold each other accountable. If that shift occurs, where we're really real from the global perspective, to really deploy the resources, then we'll see the shift in progress towards UHC. So long as we continue with the model that we had, where, like Sened mentioned, vertical funding, hyperfragmentation, various interests here and there, reality is, for the pregnant woman, for the child who is sick, they go to a primary healthcare center. They want to be assessed. They want the health worker to see them. They want the commodities to be there. They want to be able to afford the care. So an integrated perspective is what is needed. So in the case of Nigeria, the Health Sector Renewal Investment Initiative, which was launched by our president, is precisely trying to do that, to pull everyone in one direction, subnational units, development partners, but with a laser focus on results, and results at scale. Not results in one district or one state, and also results focusing on the most vulnerable, the poorest, who are left out. So that's really the shift that I hope we can begin to see in the next year or so. And I will also reiterate for us, for the bank colleagues that are here, for GFF, who are doing an amazing job with us, and many other partners that are also trying to support Nigeria in this journey, that we can put on the table at least 100 million population that can be reached with access to basic healthcare services. So if the bank is really going to go all out for this, Nigeria now, this is where we are and this is where we're going. Thank you.
Thank you, Mohammed.
Yeah.
So, last